Hi, I'm Dr. James Bissland. I'd like to welcome you to September 2012 of Health and Information. In our program this month, we're going to have two parts of the program. The first part of the program, I'm going to discuss a couple of things relative to the time of the year that we're in. And the second part of the program, we're going to take you on a tour of our facility, showing you the different modalities we have for active and passive therapy, as well as the examinations we have for the chiropractic exams and the rehabilitation and neuromuscular. Just a couple days ago, we had the 11th anniversary of the attacks on the World Trade Center in New York, on the Pentagon in Washington, and the plane crash of United Flight 93 in Pennsylvania. And as we observed the remembrance of the tragedies that struck the United States on that day, we had additional tragedies overseas. So our war on terror appears not to be over. There are little groups in all countries over in the Middle East that just don't approve of the way that we do things here in the United States. We have the freedoms that they don't have. We have the right to free speech that they don't have. I was talking to one of my patients here recently who is a veteran, and so many of our veterans that we have talked to, and so many of our veterans that are disabled and are having difficulties, are not getting the benefits that they need from our Veterans Association. These are the people that fought, sacrificed, and some of them gave the ultimate sacrifice for us to be able to have the freedoms that we do have in the country. Right now we're in a crossroads. We have so much going on around the world, so much anti-American Semitism in the Middle East. Our election time is coming up in November. We have a presidential election, we have congressional elections, we have Senate elections, we have state Senate, state representative, as well as local elections. And you know, one of the biggest things that I've seen develop over the last few years, just in talking to patients and talking to family, talking to friends, is apathy. People just don't seem to be caring as much as they used to. Voting doesn't seem to be as important as it used to be. But you know, there are people who immigrate to this country. There are people who move here and become citizens and go through all of the problems and the processes that it takes for them to become an American citizen, so that they have the rights that those of us who were born here take for granted. And voting is one of those. Well, we have a 13% of the people who are registered to vote turn out for an election. That shows that we have a lot of apathy, that we either don't care, or we don't think our vote's going to count, or we don't think our vote matters. And as we found out in the election of 2000 between George W. Bush and Al Gore, votes do count, and it is important. So I encourage all of you to get out on the election day, November 6th, and vote. Whether you're Republican, Democrat, or Independent, and no matter whether you vote in the presidential election for President Obama and Joe Biden, or whether you vote for Mitt Romney and Paul Ryan. But vote, and that way your voice is heard. And you know, my father used to have a very interesting statement he made to us as we were kids, and that is, if you don't vote, then don't complain. We're going to take a break for just a minute, and we'll be right back and take you on a tour of Bissland Chiropractic.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine? Or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Murray now. Electricians with a mission will get you connected. We're Murray Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected. We're Murray Electric.
Welcome back to Health and Information for September 2012. And as you can see, we're in a different place now. We're in the reception room, and we're going to begin our tour of Bissland Chiropractic here. When you first walk in the door, you see our reception desk counter. We have electronic sign-in, so it protects your privacy. When you sign in, you'll then have a seat. If this is your first visit, our receptionist will give you the paperwork that you need to fill out. You can have a seat over here, fill the paperwork out. Now, in the future, it'll probably be done electronically, and you can even do it at home, but we're not quite there yet. So right now, we do it while we're here in the office. Now, many of the people, when they call in, they say, well, I got to schedule when I have somebody to watch the kids, or I have to schedule when I have my husband or wife gets home from work so that the kids will have somewhere to be. Well, we have a children's area that we'll show you as we go back to the back here in just a minute. And we have movies and games and toys that the kids can play. We also, as you can see over here, we have fresh bottled water and hot fresh popcorn. You are encouraged to have a little snack while you're waiting for us. One of the things that we're very particular about is that we don't want you to wait. When I look at going somewhere, if I have to wait for a long time, it gets kind of a little annoying. So it's one of the things that I try not to do in the office. I remember a friend of mine used to say that when Delta Airlines used to have a sign at their check-in gates at the airports, and it said on time is 10 minutes early. We try to live by that. We try to run our office on time, if not ahead of time, so that you don't have to wait. Now, if you come in and you don't have an appointment, you may have to wait just a few minutes, but we never have you wait very long. On your first visit, after you fill out your paperwork, we go back to do the consultation. Okay, now we're in the consultation room, and this is probably the most important area of the office. When I sit down with a patient for the first time, I'm going to ask a lot of questions about your health, your history, your drug interactions, your allergies, anything that you're taking as far as over-the-counter medications, vitamin supplements, as well as prescription medications. Also, here's where we're going to talk about your symptoms. I want you to tell me everything that is important to you. And the one question I'm going to ask you here in consultation is, what is it you hope that I can do for you? Because as we go through the process of examination and x-ray, and I come up with a treatment plan and a diagnosis for you, I want to gear that treatment plan to help you meet the goals that you want to meet. This is not an office where we have canned treatment plan. Oh, you got headaches. Great. Headaches, we do this and this and this for. Now, sometimes we do have those for specific things, but every treatment plan that we give to you on your report of findings is specifically for you. It's not the same as anybody else's. It's not the same as somebody who might have the same type of symptom that might have a different cause. And that's what we're looking for. We're looking for what's causing your problem, what's causing your pain, why are you having the problem you're having. If it's a chiropractic problem, what can we do about it? And that's how we come up with a treatment plan. Now, in order to do that, once I finish with the consultation where I'm asking you questions, I'll do some preliminary exams. I'll do palpation, which will tell me if you have some trigger points and some sore spots and muscle tenderness and fixations or tightness of the spine. I may do some orthopedic tests, some neurological tests. We might check for the possibility of a disc if it's a low back end or a neck problem. After we finish that, we'll move on to the exam room where we'll do more of the diagnostic exams, rehab, and neuromuscular exams. Now here we come into the exam room, and we have a pretty wide variety of examinations that we do. The first one that we want to show you here is called the contour analysis. Contour analysis is a three-dimensional moire picture that's taken. We shine a light through these lines, these strings on the screen, and they create a three-dimensional picture on your back. That picture should look like this one here on the wall. Circles should be symmetrical. We should see a butterfly pattern here in the low back. Shoulder blades should be symmetrical and level. We're looking for the left side of the body to look exactly like the right side. If we have any distortions in here, that leads us to look further into spinal distortion. Posture analysis is important because it tells us biomechanically whether we have a head tilt, a high shoulder, or a high pelvis. This is our posture analyzer. It's also our rehab, which we'll talk about in just a minute. But when we look at this, we compare what we see here to the contour analysis, as well as we look for bilateral weight. Now, on the floor here in front of the posture analyzer, we have two black feet on the floor. That's our bilateral weight scales. When you stand up, you should carry the same amount of weight on each foot. If you have anywhere from a 2 to 5% or more difference from right foot to left foot, we know we may have a biomechanical problem and distortion going on. The new map exam is this one back here in the corner, and the new map is a measurement of the side view of your body, just like we did the posture. If we look for left shoulder high or high hip on the left or right side, we're looking now at the side view. We're looking for the spinal curves that are naturally there, seeing whether they fall within the normal range. And we look to see whether your body, as you stand up, if you're leaning forward or if you're leaning backward. This gives us a very significant amount of information as to what is causing the symptoms that you may be having. Now, we also want to look for nerve interference and nerve irritation, and we use the dermathermograph, which is this unit here. The dermathermograph is an infrared reader, and it reads the temperature of your back from the pelvis all the way up to the skull. If we have an area that the nerve is irritated, that temperature will be high. If we have areas of pinched nerves or nerve interference, then that temperature will be reduced. And again, that correlated with the posture analysis, the contour analysis, the new map, and my palpation findings go a long way toward helping me make a proper and correct diagnosis and making a determination as to what can be done to help you. Now, we know that the feet are the foundation of the body. And so every patient we see, we do a foot scan. The foot scan is done here with standing on the posture analyzer, and it's run through a computer program here that is designed to show us whether the arches of your feet have fallen, whether there's pronation or supination of your feet, and how bad it is. And we get a printed report that shows us in color how well it's doing. Now, you might also be scheduled for a rehabilitation exam, and our posture analyzer doubles as a rehabilitation analysis device as well. Now, in spinal rehabilitation, we're looking to see whether any part of the spine, neck, mid-back, or low back, or pelvis, has shifted to one side or the other, or shifted forward or backward, whether it's tipped one way or the other, or whether it's rotated. These components make up the findings when we have somebody who has a biomechanical distortion that is required to be corrected because of muscular imbalance and muscular weakness. It's corrected by strengthening exercises that we have out there. We'll go over that when we go into the therapy room for spinal rehabilitation. We also do the neuromuscular re-education evaluation. And the neuromuscular tests are done here, and they are more of a functional test to tell us how your body is functioning, how everything is working. We're looking for the core muscles here, the deep core muscles of the abdomen and the pelvis. Because if the core muscles are weak, it's going to throw the foundation of the body and the spine off. And just like your foundation of your house, if the foundation is not level, then the house can't be level. So we want to strengthen those when they're there to find out whether or not we can then get a correction and level and balance those muscles, which will then lead to us to be able to correct the cause of your symptoms and your pain. Let's go ahead into the x-ray room and we'll talk about x-rays. Okay, here we are in our x-ray room. Back in 1895, there was a German scientist named Wilhelm Conrad Röntgen who actually discovered the x-rays, and through research over time, pretty much developed and made x-rays usable for diagnostic purposes. And we've used x-rays in chiropractic for almost 100 years, probably, maybe even more than 100 years. But I use x-rays in the office here for each patient when I first start care, or when they first come in for their initial exam and evaluation, for two reasons. Number one, I do a biomechanical analysis. I want to see how those bones line up. Number two, I want to make sure there's no contraindications for treatment, such as degeneration or severe rotations or abnormalities, or in very rare cases, organic lesions such as cancers and tumors. Anything that would be on that x-ray that could cause damage if we treated it without knowing about it. And this is why we take x-rays. We don't take them routinely throughout your treatment plan, because we have all of our other exams to help us. But we do take them in the beginning so that we know what condition the spine is in, so we know biomechanically how well you're aligned, and to make sure that we don't have any contraindications for either manipulation and or any of our physical therapies. We're going to take a break. When we come back, we're going to go into the therapy room. We're going to talk about the spinal adjustment, the passive therapies, and finally we're going to end with the active therapies, rehab, and neuromuscular.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected with Marie Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected with Marie Electric.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Well, welcome back to Health and Information here, September of 2012. I'm Dr. James Bissland, and we're continuing on our tour of our facility here at Bissland Chiropractic. As in most chiropractic offices, the spinal adjustment is the most important part of what we do every day. It's correcting the subluxations. Now, when we're talking about subluxations in a chiropractic language, we're talking about a misalignment of the vertebra, It's putting pressure on the nerve. It's causing nerve malfunction. If we don't have that, we don't have subluxation, we don't have a chiropractic case. So when we go through, after all the exams and all the x-rays, I sit down, I go through, I analyze, look at everything, come up with a diagnosis, come up with a treatment plan to help meet the goals that you and I talked about in the consultation. So when we come to the spinal adjustment, most of the time I use an instrument here. It's called the Pulsar. The Pulsar is a computer-aided device that helps me to see on visit-to-visit basis how the spine is responding from a fixation standpoint. It shows me where the spine is tight or where there's also muscle spasms in the spine. I'm able to look from one visit to the next and keep a correlation of how we're progressing and as we're moving along. Now, I also use an instrument called the activator. The activator was probably the first, or one of the first, instrument that was ever created for adjusting the vertebra as well. After the activator came along, we started using something called the integrator. And the integrator is a very interesting tool as well, because it allows us, if we have a very specific area for rotation, like in the sphenoid bone on some patients, or in the knees or the extremities, we can actually do some torque involved with that as well. Now, when we're finished with our spinal adjustment, we will, in the beginning of care, order some what we call passive therapy. And we're going to talk a little bit about some of the passive therapies that we have. The first one over here that I want to talk about is infrared therapy or light therapy. Now, last month on our program, we had Dan Paris. Dan was the man who invented and developed the pulse light therapy that we now use. Infrared therapy, as you can see here, this is the large full spine pad, and it lights up in the specific frequencies, just like we talked about last month. We also use something called infrasonic, or in the Chinese term, it's called qigong. And infrasonic is a low-frequency vibratory therapy. It's like ultrasound is high frequency, infrasonic is low frequency. Now, this particular infrasonic that we use here has something called chaos. Chaos is a change in the pattern of the vibration so that their body does not become immune to the specific stimulation. It changes the pattern so that the stimulation stays fresh. Now, also on this area of the office, we have electrical acupuncture. We treat acupuncture points that need either tonified or sedated, and that's another topic we're going to cover in a future program. This is also our unit that we use for auriculotherapy. Auriculotherapy is the electrical acupuncture of the ear, which is used to treat pain in a lot of cases. But more recently, we're using the auriculotherapy more for addictions, compulsive disorders, obsessive compulsives, and hormone imbalances and protocols for those. Again, that's something we'll cover in a program. Probably after the first year, we're going to do a program on the addictions and compulsive disorders. Now, when we're treating a spinal related problem, we generally will have spinal fixations, and so we have intersegmental traction. Now, the intersegmental traction is like a roller table, and the rollers come up and they go down, and they go up and down as they go along the spine. Each time the roller comes up, it stretches and relaxes the little muscles that go from one vertebra to the other, as well as the vertebra joints themselves and the paraspinal muscles, thus allowing for the adjustment to stay longer, to hold longer, and the muscles to be more relaxed. Okay, now here we are over in the electric stim area of the office. We have 3 electric stim units. They're basically interferential, but we use a machine that also was developed and built for us by Dan Paris. But Dan made these for us to have the same 7 frequencies that we talked about last month in the infrared therapy. So we can use this to go deeper into the joint, deeper into the muscles with an electric stim current. Now, remember we talked earlier in the x-ray room about that we take x-rays because we have to rule out contraindications. There are things such as surgical implants, artificial hips, artificial knees. When they do disc surgery, sometimes they'll put screws and bolts in to hold the vertebra together. That's one of the reasons why we take x-rays, because one of our therapy modalities, especially this one, are contraindicated for things like that. That's why we go to the infrared therapy for that type of treatment. Now, in this area, we have 3 units. We have 2 that are sitting in the chair. We have a table here that people can lay on if they are in more pain than they can handle by sitting up, or some people just like to lay down and relax. Other people like to have a seat in the chair. So what we've done is we've put a little TV here that gives them something to watch and read, and it's all chiropractic and healthcare related, so that they can learn some things. And we also have, like CNN and Fox News, we have a little news ticker on the bottom there that allows people to see what's going on, and we can let people know happenings and news events and things that are going on here in the office. Now, one of the other things that we have that is very unique to our office is we have a traction machine for carpal tunnel syndrome. Carpal tunnel machine is a intersegmental traction. It's a long axis traction. We put the patient seated on either side of the machine, put that affected side in here, wrap it, and then the machine will pull and relax on the wrist, helping to correct the carpal tunnel syndrome. Now, in that case, somebody has carpal tunnel, we may use the electric stim for the pain as well as the carpal tunnel traction, but we always also adjust the spine as well as the wrist, because 50% of carpal tunnel cases have a cervical spine component to it. So we will always check the spine, and if it's needed, adjust that as well as while we're doing any carpal tunnel treatment. So these are basically our passive modalities, our passive therapies. Let's go over to the active area, to the rehab and the neuromuscular. Okay, now in our active therapy area of the clinic, we have the spinal rehabilitation and the neuromuscular reeducation. Let's talk first about spinal rehabilitation. Now, when we were in the exam room, I showed you how we use the analyzer to determine the translation, which is the shifting of the areas of the body, the lateral flexion or the lateral bending, or the forward or backward flexion extension, as well as rotation. So we use a system called the Nexus, which is a neck exerciser, and it uses resistance. So we can set the resistance level on the back here, and then they push against the resistance and build the muscle strength in that specific muscle or muscle group that we found weak when we did the exams. Now, other than the neck, the back is this area done with retention bands. These bands have resistance to them. And so by putting them in specific places and doing specific exercises with them, it strengthens the muscles both in a translation as well as lateral flexion, front or back flexion extension, or rotational. Now we have 2 sets of bands here. We have the light bands, which are the yellow, and we have the heavy bands, which are the black ones. And there is a pretty significant difference between these 2. Now, every 12 sessions of rehab, the protocols ask for a reevaluation. And so we'll go into the exam room and we will redo the rehabilitation exams to determine what's changed, what's improved, what now shows up that maybe didn't show up the first time, which does happen, or in some cases, what's still not improved to the level that we want it to. Now, also in the exam room, we have done the neuromuscular reeducation. That's our newest therapy or modality here in the office. Neuromuscular reeducation is training and retraining the spine and the body, the connection between the brain, the nerves, and the muscles. And it's primarily geared toward the core muscles, the bulk muscles in the pelvis and low back and abdomen. These are the muscles that if they're weak and or we don't have a good reception between the nerves and the muscles, we have a loss of proprioception, a loss of kinesthetic activities. This is where some of our people and patients, as they get older, they just don't feel as steady on their feet. And the test will show us how severe this is in each individual case. Now, as in all exercise, you want to warm up first. So we have developed or determined that the best way to warm up for most people is the rebounder. The rebounder is a special trampoline that helps to warm up the muscles so we don't have any muscle pulls, but it also milks the lymphatic drainage so that we can get rid of some of the spasms and we can get rid of some of the stiffness going on in there as well. Now, after the warm up, we go over here to our exercise mats. And the first set of Neuro-Muscular, there's 6 steps to it. The first step is where you train the body how the pelvis is supposed to be tilted. And that's a really important one, and that's one of the hardest ones for people to do. Then we go up and start working on the balance. So the first and the second stages are done on the mat or standing up. Steps 3, 4, 5, and 6 are done by the use of the inflatable Swiss balls. As you see, we have 4 here: the yellow, the red, the green, and the blue. Now, the yellow is for smaller people, and then the red, the green, the blue is for our taller patients. And we have these so that we get a perfect fit for about every patient type and height. The exercises are done on these in 3 stages of each step. The first one would be assisted. The second one would be patient can do it without assistance. And the third one, we add complications into it before they can move on to the next one. So if you are starting a rehabilitation and or a neuromuscular reeducation program, we're going to spend time with you on each of these visits that you're here to help you to balance these core muscles with your proprioception. Your balance will become better, and overall, your health will improve.
Well, I hope that this program has given you a little bit of insight for those of you who are not our patients here at Bissland Chiropractic as to what we do, how we go about making our treatment plans, how we go about treating people with both the active and the passive therapies, spinal manipulation, and the diagnostic exams and x-rays that we take in order to arrive at the treatment plan. A couple things I want to talk to you about before we end our program today, and that is over the next few months we're going to have some very interesting programs. I'm working on several guests that are a little more well known than any that we've had so far. And I don't have anything concrete yet for that, but I've got a couple of things that we're working on that are going to be rather interesting for our viewers over the next few months. I also want to talk to you about the upcoming Tulsa State Fair beginning on Thursday the 27th of September through Sunday the 7th of October. We are going to have our booth again this year that we have for the last 17 years. We're on the upper level of the Quick Trip Center, across from the support pole number 23. We'll be right next to the funnel cakes, so you can come and visit with us. We're going to be doing the posture analysis. We're going to be doing a little bit of rehab analysis and some of our neuromuscular testing. So come on out and visit us. As you can see on the screen, our fair schedule when Lisa and I are going to be there is on the screen so that you can come by and visit us. You can also give us a call at the office anytime at 918-838-4252, and we'll be more than happy to answer your questions. Thank you for watching this month, and I hope you have a happy and healthy and safe month, and I'll see you next time.